All right. Not quite afternoon yet, but welcome everybody who's in the room and anybody who joins us in the Zoom room. My name is Erin Colbert. I am the Pre-Health Advising Coordinator for the College of Health Science here at Boise State University. I am joined with the recruiting staff for the Army Health Professions Scholarship. First Class Sergeant Freenor. See, I do it every time. Freenor is here to present some information to you all and answer some of your questions about this unique opportunity that I think is a fabulous way to help pay for your medical or dental education. So,
all right. Well, thank you everyone for having us here. Thank you to those joining us virtually. I'm joined by my colleagues, actually my two bosses. First, we have my OIC Major Wright, and then I have my newly incoming station commander, Sergeant First Class Mathews. And thank you guys for taking time out of your day. Please enjoy the lunches. For those who are in the back who don't have lunches, make sure you grab one on the way out. First things first, like Erin said, we're here to talk about the Health Professional Scholarship Program. We are going to be focusing only on medical and dental, since that's who is in attendance with us today. Just a real quick add-on note, if anyone is interested in anything else, whether it be nursing degree, advanced nursing degrees, clinical psychologists, or any other pathway, and you're looking for something in the graduate or doctorate level, please reach out to us. Make sure you take notes at the end of our contact information. We do have those programs. We're just not going to discuss them today. Our first slide is what you see. It's just our intro slide. So we'll go on to the next one. All right. This is our agenda that we're going to talk about. We're going to go over the background, qualifications, eligibility, what the selection process looks like. We're going to give you guys some numbers. Who likes money? Only 3 people like money, really? Okay, that's what I thought. And then we're going to go into details about the med core and the dental core. And like I said, there's other HPSP opportunities, but we're not going to discuss those. However, again, please reach out to us if you or someone you know has questions about those programs. Go ahead into the next slide. All right, so first things first, if you are selected for this program, and I say if, this is a highly competitive program. We only offer a finite number of scholarships every single year. You're commissioned into the Army Reserve as a second lieutenant, all right? And I'll explain the reason for that later on. You are not required to do anything for the Army while you are in school. We pay for everything, 100% tuition, okay? All of your fees, all of your books, anything that's associated with the degree plan that you are in. If you decide to take underwater basket weaving, if you have documentation that says you have to do that in order to get your degree, you're good to go. If it's just something you want to do because, then you got to pay for it out of your own pocket. You also get a stipend every single month. All right. As of right now, it's $22,540. It just went up from just about a little over $2,400 last year. So a big raise for you there. That is tax-free for you, and that goes to you while you are a currently serving full-time student. During the off season in the summer, you don't get any. You do not receive a stipend. Military pay for a second lieutenant is $3,300 and change. That's for the summer portion, and I'll explain what that entails a little bit later. It is a 1-for-1 trade-off. Meaning that if you get a 4-year scholarship, you owe us 4 years in uniform to pay back. Hey, nothing is for free, okay? But the good thing about it is you're compensated during those 4 years. It's not just you're an indentured servant. You are actually receiving full pay in exchange for your service. And once you graduate, you jump 2 ranks essentially. So you go from 01 to 03, you become a captain immediately after graduation. This includes if you're going to be doing any advanced education, either for my dentist, if you're going into the advanced general education for advanced education for general dentistry, or if you go up to a resident as a dentist or a doctor, you still get paid as an 03 captain while you're going through your residency programs. Got to be a U.S. citizen. This is a full-time active duty. If there is a reserve commitment, you're allowed to have an I-551 or green card. However, because this is only for active duty, you have to be a full-blown U.S. citizen. That means either you're native born or you've received your naturalization papers. You have to, this one's a little bit tricky. So you have to have either, in order to apply for us, you don't have to have a letter of acceptance, but you have to have applied at a accredited school. In order to receive the scholarship, you have to have been accepted into a program, which kind of makes sense. You can't get a scholarship if you're not going to school. So that's how that works. It has to be US. It has to be a traditional brick and mortar school. With the pandemic currently going on right now, we understand that some of your classes will be online. We're not talking about that. We're talking about what's one of our online schools that we for our undergrads that we have for the Army? What's one of our schools? AMU. So AMU is a strictly online school. Grantham University is strictly online school. That would not qualify for this program. You have to be a full-time student. This is not a part-time thing. It is a 4-year deal. You have to be you have to be out the door in 4 years. You have to meet minimum acceptance criteria. For as far as minimum acceptance, we'll talk about that a little bit later. Med school, you're the only one that has it. Dental school, your test scores and your GPA will determine how what's the word I'm looking for? Thank you. Through me further. Your scores will determine how competitive you are for the program. You have to meet eligibility criteria. As for what that means is we're going to ask you a bunch of questions about your background. So, next slide. Accredited. This is exactly what you have to look at. What are these schools? It has to be an MD, and we do now accept DOs. We've been doing that for a while. A lot of people are concerned that, hey, if I go to if I'm going osteopathic, that I can't get this. No, that's not true. Anything in dental, and then you see the other ones that we have. So CRNA, nurse practitioner, optometry, clin psych, and then veterinary. Next one. And again, make sure it is a U.S. base or Puerto Rico. The only one that's allowed to go outside the U.S. is the vets, and you are allowed to go to Canada. So, all right, so this is what our process looks like. This is not a short-term process, okay? For those of you online, if you are currently a senior and you are applying at dental school or medical school, you are looking to have somebody help you out with this, you need to be in contact with us immediately, especially dental. Dental program is only once a year. Med school is throughout the fiscal year. First thing you do is you call us. All right. For those of you who are here, you can talk to us. Everyone else is going to call us. And we're going to ask you a whole bunch of questions. All right. Find out where you're at in your undergrad, where you're at in the process for going to school, if you're taking a gap year or whatever have you. And then we're going to advise you on what to do next. That's where the appointment takes place. After that, the hardest part about this program is deciding that you want to do it. It really is, okay, because this is not I want to stress to you, it is not a short-term obligation. This is a long-term deal. For the most part, you are going to go to 4 years of med school, and then just about every single one of you, hopefully, go off to a residency. Your payback time for that 4 years in school does not start until after all of your residencies are completed. So if you go to so you're a dentist, you're going off to be an optometrist, okay? Once your residency is done, if you decide to do any fellowships, you go off for a couple of years to do that. Once all of your education is done, your advanced education after your med school is done, that's when your payback time starts. So if you're doing a 3-year residency, you're going to do 4 years after your residency is completed. So that means you're going to do 7 years in uniform. So you're going to be attached to us for over a decade. So again, not to scare you off, just to open your eyes and let you know, hey, this is not something that's short term. It's not a 3-year deal. Okay, so make sure that you understand that, not just for you, but for your families as well. Once you start the process, we just go about it. It's basically just like filling out any job application, except ours is on steroids. Okay, we're going to go through your medical background. We're going to go through your law enforcement history, meaning have you ever been arrested or anything like that. We even count parking tickets. Okay, Not that it's going to go against you, so you have to know everything about you. We can deal with just about anything. We don't like surprises. Okay, surprises tell us that you're trying to hide something. You get us a whole bunch of documentation, your social security card, birth certificate, your MCATs, DAT scores, things like that. Once that's done, you fill out the application, you send it to us. You want to get this to us immediately. On the applicant's part, you're looking at about maybe 2 days worth of time if you really sit down and do it. On our part, we're going to put about 100 man hours into each of your packets. Okay, the sooner we get everything, the sooner we can get you through this process. The less painful it is. The only real day that you're going to be out of sorts is when you do your medical physical. Okay, that's done at a place called MEPS, the Military Entrance Processing Station. There is one here in Boise, which is literally right down the street from you guys. And that's where they're going to basically just go over your medical history, make sure you're qualified medically to join the Army. After that's done, we complete your packet. We send everything on up. There's about 7 different levels of people who check to make sure your packet's right, that all your I's are dotted and T's are crossed. And then we wait for your board date. During that time, you're going to go through a security background check. The security background check will not be completed before the board date, before your selection, before you even start school. It takes a minute. Okay. One of the things that you also have to understand that, and one of the documents that you sign prior to, is you understand that, hey, the security background check's not completed. If we find something out that you've omitted, even if you're in the middle of school, we're coming after you. We're going to kick you out of the Army, and we're also going to recoup any of the money that you've taken so far. So again, I say that not to scare you, just make sure that you're telling us everything you got. Okay. Oh, no, go back one. Right. There. Okay. Once we go through and your packet is completed, then you go to the board. It is a virtual board. You will never meet people who do the selection process. They're going to go based off the strength of your packet. The things that they look at are your GPA, your entrance exams, so your MCATs and your DATs. For those who aren't doing a medical school or dental school, they're going to look at your GREs. Okay. They're also going to, but the real strength of your packet is based off of your statement of motivation. This is why do you want to join the Army? Why do you want to be a dentist? Why do you want to be a doctor? Why do you want to be a nurse practitioner? Why do you want to be an officer in the Army? Why do you want to be an officer who gets to practice these specialties? So hammer it home. Hey, I have lineage in, hey, this is tradition in my family. There is no tradition in my family. I want to start it. Hey, I want to help people across the world, whatever it is. And we help guide you through that process. You send us what you got. We give you examples of what it should look like. You work on it, give it to us. We're going to red ink it. We're going to send it back to you for corrections and additions or whatever have you. The other thing is your letters of recommendation. You have to submit at least 3 letters of recommendation in order to board. You can submit up to 5. I always tell all my applicants, keep giving them to me until I tell you to stop. So my record is 16, and I told that guy to stop. All right, I got enough. All right, I don't need any more. Okay, because you never know how someone's going to write. They may be the greatest person in the world, but they may write like a 7-year-old. Okay, so we want to make sure that those things look professional. Again, that's what our job is to make sure that we're putting forth the best product that we can. After your board is completed, it takes about 2 to 3 weeks for the results to come back. There are 3 options. The first one is you are not selected, meaning that essentially that you're not qualified. Okay. The second one is what's called the order of merit list. Okay. The order of merit list is essentially like a wait list. You are qualified. You have you're qualified. You're on the list, but you haven't gotten a spot yet. That list is good all the way up until the end of our fiscal year, which is September 30th of every year. So you can be pulled off it at any time. And the third one is you've been selected. If that happens, we're high-fiving and you're buying first round. Okay. So and that's all on that one. Let's go on to the next one. If you're selected, there's a whole bunch of other stuff, but we'll get into that when you're selected. All right, numbers. Again, only 3 of you like money, so the rest of you guys can ignore this slide. For 10.5 months while you're a full-time student, this is the stipend that you're going to get. It totals to about $26,000 and change, give or take. This number does go up every year when you redo the budget. Sometimes it goes up a lot, sometimes it goes up $10. Your ADT pay, so your active duty training. This is in between your summer, during your summers. So there's 3 requirements that you're going to do while you're a med school, dental school student, or whatever have you. The first summer, you're going to go what's called the direct commissioning course. That's where that's basically the officer's basic training. Okay, it's just like my basic training without all the yelling and hitting and griping and complaining and all that. They're going to teach you how to tie your shoes. You're going to learn how to fire some weapons. You're going to roll around in the mud. You're going to do all the cool stuff and everything like that. But again, no one's going to yell at you because you're officers. That goes on for 4 weeks. That's 4 to 5 weeks. That's in Fort Sill, Oklahoma. You receive full pay for that during that time. The second one is between your second and third year. That's when you go to basic officer leadership course. This is about 7 weeks long. It's in Fort Sam Houston, San Antonio. This is where you're going to learn how to be a medical officer. If you're a dentist, you're going to learn how to become a dental officer, what's required from it. If you're a doctor, same thing, so forth and so on. The third one is when you're going to do your shadow. So if you're not sure what kind of specialist you want to be, this is when you're going to get your chance to shadow other military positions and dentists. You're going to go around, hey, you know what? I wanted to be a podiatrist or a periodontist. Not anymore. Hey, I wanted to be an orthopedic. Not anymore. I don't like bones. I want to do this other thing. So that's when you're going to really find out. That's also a very important time because this is when you're going to meet with people who are going to help you with your recommendations for your matching. Okay. If you don't know what matching is, you have to match into a specialty when you graduate. You can't just graduate from med school and actually practice. You have to be board certified in a specialty. This is when you're going to meet those individuals who are going to help you match into your program. Let's see the other numbers that we got here. These last two is the housing. So while you're on the active duty portion, you're getting your base pay and you're getting your housing allowance as well. Anything that's over 30 days of activation. So housing is based off of your rank and it's based off of your zip code that you're stationed at. So this housing allowance is based off of a first or second lieutenant who's based in Salt Lake City. That's where we're from. And then your subsistence allowance. This is your food allowance. Okay. Any questions on that one? No. All right. Next slide. All right. So MedCorps, you have requirements for your scores. You have to score at least a 500 on your MCAT and at least a 124 in each of the subsections. Okay. If you do the math, there are 4 subsections. And you got to get at least a 125 and 2 of those in order to hit that 500 number. If you don't, do not freak out. Call us anyway. We can do what's called a MAC waiver. All right. Basically, we can say, hey, you know what? We understand that this person only got a 499. However, there's other stuff. We're asking that you make an exception and still let them board for the scholarship. Got to have at least a 3.2. Overall GPA. This includes all colleges that you've been to. So if you came to BSU and you rocked it and you got a 3.7 or 3.8, however, you went to the local community college for 2 years and you got a 1.6, we add it all together. Okay, so please keep that in mind. Again, we can get waivers for this as well. If you're not sure, if you don't meet that criteria by your math, call us anyway. We have a lot of little tricks that we can do for you. Okay. Dental Corps. You do not have a minimum criteria for your DAP or your GPA. However, this is not golf. The low score doesn't win. Okay. The higher the number, the better your chances are. Next slide, please. Okay. Now we're going to go into the MedCorps a little bit. All right. So at any given point, about a third of our medical community is in some type of additional medical education. There's some kind of general, they're learning more. Either they're in a residency, they're in a fellowship, or they're just continuing to be educated. We have the largest program in the military, which is why that's why I do this, all right? Because we can offer you things that no other service can. Not to say that the other services are not good or anything like that. It's just we're a larger service, so we can offer things that they cannot. We have 71 different residencies 73 fellowships. So for my med students, it's endless. You're going to see a list of our most popular residencies, but again, that's not all the residencies. So again, if you have something, I challenge each of you, if you're interested in something that's a little bit different or weird, call me and we'll see if we have it. I have yet to find anyone who says I'm interested in this residency and that we do not offer it. 10 different training locations in the hospitals. These locations also near the ones for dental as well. When you guys are doing your residencies and when you're doing your shadowing and all that, these are one of the locations you guys are going to go to. Let's see, eligible programs accredited and in good standing. So one of the common questions that I get is, well, this is all fine and dandy, but this doesn't do anything for me when I leave the Army and go somewhere else into the civilian sector. Yes, it does. Our programs are rated in the top 10% of all programs that are out there. So we are not bottom of the barrel regardless of what anyone else may tell you. And the biggest thing, bottom one, 96% first-time specialty board pass rate compared to the civilian sector, which is about 9–10% lower than ours. The number one reason, this is usually when I ask, I do a little Q&A with the audience saying, hey, why is that? Why is that? I'm going to tell you. The reason that ours is so much higher is we take away all your stress. All you have to worry about is what? School. That's it. You don't have to sit there and worry about, hey, these loans are stacking up. Am I going to get a residency somewhere that's not going to pay me very well? Do I have to defer my loans after school is done? Do I have to get a part-time job to make ends meet while I'm going through school? All that stuff, we've just taken it away from you because we provide everything for you, including a contracted job once you graduate. Takes a lot of pressure off, so you're able to focus more on your studies, and that's why you see a 10% difference. And when it comes to not only getting your board rate, but also when you're looking to match it. Next slide, please. Different locations throughout. All right, so if you're cool, you're going to go to Hawaii. If you're not, you're going to go to El Paso. No, I'm just kidding. No, different locations. So wherever you want to go, hey, there it is. You can go onto the beach, you can go into the desert, you can go into where they have trees and rain and stuff like that. You can go onto the East Coast, West Coast. We're pretty much scattered. Why are we scattered? Because we want different experiences from everyone. We want a hodgepodge of people, and we need them all over the place. Now, I know you guys see on the slide, you see overseas, you see Korea, you see the Pacific, you see Europe. Those are locations that you can also be stationed at after you're done with school and done with your residencies and everything like that. All you got to do is ask the question. The worst that they will say is, no, you're going here. That's it. But if you don't ask for it, you won't get it. Next slide. All right, again, some of our residencies: internal medicine, general surgery, neurology, pathology. The biggest ones that we have are, as far as number of slots per year, is general surgery and emergency medicine. Those are our big ones. Reason why we look for those a lot, and again, this is not something that you have to do. You get to choose what residency you're going to go to. We're not going to tell you, okay? But we have a lot of those because we want general surgery and emergency medicine. They're kind of considered, hey, they can kind of do a jack of all trades type thing. They can pretty much work on the go, and also we do a lot of trauma because we move constantly are moving around. However, I want to stress that we don't tell you what residency you apply for. That is up to you. Also, we do not guarantee a residency for you. Okay, that is also up to you. We will guarantee that we are going to pay for your med school. That's it. It is your job. It is your responsibility to be the best med, dental, or nursing student, or whatever have you, so that way you can match into the residency that you want. Okay. I also want to make sure that you guys are aware. Hey, make sure you have more than one specialty that you're interested in. Do your homework. Look around. You do not want to be a one-trick pony, because just in case you don't match into that one thing, if you don't have a backup, then you just wasted 4 years. Next slide. Obligated. All obligated students are required to apply. Oh, did we?
Should I go back?
Go back one. No. Okay, go ahead. Okay, I'm sorry, I misread it. Okay, so you have to apply for a residency. Again, you have to have a specialty. All right. the match. So how the match works is it's just like applying for your med school. Okay, you're going to apply on multiple ones, and based off the strength of how well you interview, how well your letters of recommendation are, how well you did in school, and all that, that's going to determine if you're going to match into the residency you want. 85% of our people who accept this scholarship match into their first choice. Civilian sector, 75%. Still both very, very high. However, 10% better shot than that you're going to get your first choice with us and then with anyone else. Most competitive, there you see. Emergency medicine, surgery, specialties, physical medicine, and dermatology always throws me for a loop. I didn't know that we had a lot of people going into dermatology, but to each their own. Now, again, if you don't match into your specialty, that does not mean that you are out of luck. You can try again. Okay, just keep trying, keep trying. Stereotypically, if someone doesn't match into a residency out of med school, become basically a general practitioner. You're going to do that for a year, and then you're going to try it again. And they're going to keep it. It's not a one-shot deal where if you don't make it your first try, then you're out, and now you got to deal with consequences. No, our goal is to help you get into this, because think of the Army as a business. We don't want to just put someone through medical school and at the first chance that they trip and fall, then we just throw all that away. No, we're not going to do that. We're going to help you guys get to your end goal. Next slide. Okay, military and civilian sponsored fellowship training programs. Now, you are allowed to work in a civilian sponsored residency and or fellowship program. This also goes for my dentists as well. However, you can't apply for them, if that makes sense. We are going to try to keep you into one of our military specialties because our training programs, because we want you to learn the military lifestyle of how we do things. If you qualify for something, we just can't accommodate that. We're going to send you off to it. However, you can't choose to go to a civilian market, if that makes sense. The thought process being, if you go out to civilian and when you come back, now we got to retrain you on our policies and procedures. And again, and it just kind of makes it a little bit harder for the individual to make that switch over. So if we keep you in house, boom, you can go right into it after your residency and or fellowship is completed. Let's see. Oh, no, back one more. Expectation of utilization to or following residency completion and prior to fellowship. You may be selected for a residency program by needs of the Army. What that means is understand that you are going to have a lot of control over your career and everything like that, but you do not have ultimate control. Okay. If you are trying for something and the Army says, hey, we need you over here instead, essentially that could happen. All right. Does it happen very often? No, it does not. However, you have to, it's just like a deployment. Or people, one of the common questions is people's like, how often do I go over here? How often, what's the likelihood that I'm going to get where I want to go to? That kind of stuff. We're going to try to accommodate you best we can. However, you have to wrap your mind around that. Hey, if you want to go to Hawaii, but I need you in Fort Polk, Louisiana, because I'm already staffed up in Hawaii. Well, guess where you're going? You're going to Fort Polk. Sorry, that's just one of those things. If you don't ever want to deploy overseas and go anywhere else outside the U.S., hey, okay, fine. But if you are not prepared for the fact that that could happen, then you are doing yourself and your family a disservice, because you're not going to be prepared for it mentally and emotionally when that day comes. Okay, I always say it's a matter of if, not when. I'm sorry, it's a matter of when, not if. Follow-on assignments in large medical centers and residency programs and fellowship opportunities. It says to contact us for your fellowship opportunities. This is after you're done with med school and your residency. Don't contact us. You're going to contact your chain of command. We don't have anything to do with your fellowship work. That's way outside our purview. Next slide, please. All right, dental form. All right, everything I just said for the med, just put dental in front. I'm just kidding. Next slide. All right. Essentially, it's the same program. There are a couple different stipulations. The first one is you have to apply for the Advanced Education in General Dentistry. It's a one-year residency. You have to apply for that. We walk you through that process. It's in between your third and fourth year starting. You do not have to accept it, but you have to apply for it. Okay. These are the locations of the programs. They also have 2-year programs if you're interested in getting a 2-year residency. I say, hey, even if you're interested in, like I know the 2 of you are looking at family general dentistry, and I know you're looking to specialize. I say apply for it and take it. It's just an extra education, and you can go into your specialty residency later on. Okay. One thing about the residencies, if you apply for it, there's a nasty rumor going around that, oh, well, I have to do this, I have to do that first, I have to do general practitioner type stuff before I can apply for one. That is not true. If you apply for residency and you match into it, you go straight away right out of the school. Okay, we want those specialties. Next slide. Okay, some of our specialties that we have. Again, not all of them, but these are just a snapshot of them. Next slide. All right, so why the Army? All right, why the HPSP? The number one thing is you got your short-term goals and your long-term goals. Your short-term goals right now for the undergrads is to graduate. Okay, that's when you're in your freshman, sophomore, and junior year. Seniors, your short-term goal is to make sure that one decide, am I going to take a gap year, or am I going to try out and go straight into my next program? Then how am I going and identifying what I need to do? How am I going to get there? How do I make my package stronger? How am I going to pay for this? All right, that's where we come in. Okay. Am I going to apply for this or not? Again, short-term planning. Long-term is where do I want to be, and how will this program help me? Okay. We deal with we don't just deal with students in my office. Okay, we deal with everyone from the undergrads who are getting ready to move into their doctorate program to those who have been practicing for 20, 30 years. Okay. The biggest advantage to this is the things I said earlier. You just got your school paid for all the way through, and you got a little bit of extra spending money on the side, and you have a job that's lined up for you when you're done to build your experience afterwards. Those who have done it on their own, nothing against it. But the doctors and dentists and health professionals that I speak with who've been doing this for decades tell me on average 15 to 20 years to pay off their student loans. That's a long time. So anyone who has the idea that, hey, I'm going to walk out of school and open up my own practice, think again. Okay, think again. There are other things that you have to consider. Some people look at our and say, hey, is the pay comparable? Well, for about 7 to 10 years, we can compete with those who do private practice. The things that you're not including in your base pay is the fact that you don't have to have malpractice insurance. Malpractice insurance can run average between $50,000 to $250,000 a year, depending on your specialty. Okay, we don't have that. Okay, as of right now, if I go in, you're a dentist and you're supposed to extract my wisdom teeth, and you take out my front teeth instead, the most I can do is meet you in the parking lot and have a little chat with you afterwards. That's about it. Okay, I can't sue you. All right. Right, wrong, or indifferent. That's how it works. All right. There's no malpractice insurance. Okay. The other thing that I hear from practicing healthcare providers, they don't have to deal with it. You don't have to deal with insurance companies for the most part. If you are the medical professional, if you can articulate why you want to do certain care for your patient, go forth and wreak havoc. You don't have to sit there and hope that the insurance company is going to allow you to use medication that you know will help your patient and not have to go through some other nonsense. Okay, I have horror stories that I'll bore you with later of what they go through. The other thing, so that right there, that takes a lot of chunk. Frees up a lot of your income revenue. We provide for your housing. You get free medical, dental, and vision insurance with us. If you don't know what that costs, about $500 a month for a family plan, give or take, and that's not including the deductible that you have to cover as well. So opportunities. If you are a hula person and you want to be a doctor who jumps out of airplanes or a dentist that rappels out of helicopters in order to give a root canal, all right, you have that chance to do that. Okay, I'm not saying it's guaranteed. Nothing's guaranteed. Okay, but you can ask to be that. I have a buddy of mine who took the scholarship a few years ago. One of the things he does, he works with special operations. He actually does halo jumps into the middle of nowhere for training, where they set up and he teaches the special forces and the rangers and all those special operators on how to do emergency dental care. And that's one of the things you can, so if that's something you're interested, you can try out for that kind of stuff. How many of you know your primary care or your primary dentist that every now and then he jumps out of an airplane? Anyone? No one? No? Okay. All right, I guess I'm the only one. Think about your families, okay? If you, I assume some of you, if not all of you, are looking to have a family down the road. This is a good starting off point. That way you can live the lifestyle that you want and that you can provide, and you're not buried, again, you're not buried in a massive amount of debt for the next however many 15, 20 years. Okay. And again, it just look at the percentage rates of getting into the specialty you want. 10% more than the civilian market. They're still very high on that one, but you're going to have a 10% better shot of getting what you want and a lot less stress. Okay. Next slide. Questions, and we'll go ahead into the next slide. I want to make sure this is up for those who are on the virtual. So, any questions at this time before we stop the recording? Thank you, ma'am. Gotta add that slide. All right, one of the things I forgot is by doing a 4-year scholarship, you get a $20,000 bonus if you want. You don't have to take it. I don't know why you wouldn't, but and the cool thing about it, so in order to accept a $20,000 sign-on bonus, you have to agree to 4 years. However, that 4 years runs concurrently with the 4-year obligation that the scholarship already has. If you don't know what concurrently means, it means they run at the same time. It's not consecutive. Okay, so you don't owe 8 years, you just owe 4 years. If you qualify, if you take a 3-year scholarship and you want that $20,000 bonus, you have to do 4 years. You would have to up it by 1 year. So not a bad little trade-off, but yes, $20,000 is paid in 3 installments. Your first year, you get $9,000 minus taxes. So about $7,500. Second year, same thing, $9,000. And then in your third year, you get a check for $2,000 minus taxes, about $1,500. Thank you, ma'am. Oh yes, medical and dental only. Only for medical and dental HPSP recipients. All the other ones, I'm sorry to say, do not get that. Not my decision. Someone else above me. It wasn't my call. Any other questions before we stop the recording? Any questions from the field? Anybody have anything on there?
I posted it on chat to give the options, but feel free to ask questions, please.
Yes.
So I actually just enlisted like a month ago.
Oh,
And I was
congratulations.
to the Army as a reservist.
Okay.
So how would I go about transferring from reservist
To doing this program. So what year are you in?
I'm a junior now.
You're a junior now. Okay, so the question for the Zoom is that she just recently enlisted. Can she still apply for this program? She's in the reserve. Yeah, the answer is yes. Okay, we have to do what's called a conditional release documentation. So the fact that you're a junior and you did that, that's awesome. For you seniors, don't do this. Okay, we won't have enough time. And the reason I say that is we won't have enough time to get you released because you're going to have to go to basic training and everything like that probably next summer. You have
I
to.
ship out in January.
What's that?
I ship out in January.
All right, so when you go, you have to complete your training, and then once that's done, then now we can get you released and everything. It gives us some wiggle room. For seniors, if you were to do this today, we're not going to have enough time to get you all the way through that whole process and get you into medical school starting in the next school year for 2023.
Do you
So-
have core? Do you have a core scholarship like EA does, where it's the ones that were already enlisted and then they go into medical field?
No, so on certain specialties, we do have that. That's mostly for our nursing.
Okay.
So if you were interested in pursuing a BSN later on and you are in reserves, give us a call. As far as for you, you're just going to come and do this program. Okay. Now, the great thing about that is, so for any of those who are already enlisted or they're in ROTC or anything like that, or your prior service and you're out, this jumps your chances of selection up exponentially. Okay. I'll put it this way. In my office in the past 3 years, we have processed, oh my gosh, at least 150 different HPSP applications. And even more so when it comes to those who are going for direct commission. Out of all of our prior service, anyone who has a prior service on their resume, every single one of them who were qualified have been selected. So it is a huge, huge feather in your cap. If you are an undergrad, if you are a freshman, a sophomore, juniors, talk to me first. You're kind of in there. Seniors don't do it. But if you're one of them, I highly, highly recommend that you go down to one of the local recruiters and ask about a reserve obligation, especially dental court. All right. MedCore HPSP, there is what, 275 scholarships, if I remember correctly. Is that correct, ma'am?
I'm sorry. Yeah, right.
275 scholarships. That's a lot.
275, yes.
Yeah. On average, we get about double that in the application side. For my dental school, there's 75 4-year scholarships and there's 20 3-year scholarships. The 3-year scholarships, again, if you have a question about that one, please get it with us offline. On average, we get about 400, 450 applicants. So way, way more competitive. So you want to do something that makes you stand out. Again, that's what we're here for, to help you guys out. Any other questions? Oh, yes, go ahead.
Would having a acceptance letter to say dental school that works with all the things, would that increase your chance as well?
Absolutely not. If you got a letter of acceptance, we don't want that. Yeah, of course it would. Yeah, absolutely. If you have a letter of acceptance, and that's a great question. So during the process, if you're in the process of applying for this thing and you get a letter of acceptance, even if it's not to your school of choice, your #1 pick, give it to us prior to the board. Okay. You do not have to lock in your school of choice until after you've been selected. What that does is it tells us, hey, not only this person got, a 3.9 and a 26 DAT, but they've already been accepted to a school. So that's only going to just help your cause more, because we know that you're a safe bet. That that, hey, we already know this person's going somewhere. So hey, giving them the scholarship is going to help out. And then later on, while we're doing, if you've been selected, while we're doing your what's called your post-board process, then if you say, hey, you know what, I got into the U for dental school, but then Columbia came back and told me that I want to go to Columbia. Yeah, we can switch that out. We'll let you guys. There is a drop dead point of when you can't change it, but we will let you know way in advance before that happens.
So just to add to 2 things with dental, you get most of the schools will announce their acceptances in December. So that first week in December, and when you're in the application process, you may have your acceptance in hand. You need to be applying to this scholarship program while you're applying to dental school, so that when that acceptance comes in, then that's all they were waiting on to get you pulled through the rest of the way. The same for medicine. Medicine, the application acceptances can come later, and dental schools, they can come later too. It's just that you won't get any notice of an acceptance until December for dental schools, absolutely positively. So what my recommendation has been, and they've appreciated, is if you're going to apply to dental school, apply early and apply at the same time. So in other words, you're doing the scholarship paperwork, you're doing the physical, you're doing all that stuff. Then once you have that acceptance in your hand, that's the requirement, and then you give that to them.
Yeah, and just to add on, jump on, piggyback on that one. She's absolutely right. I forgot to mention, dental is 1 time a year board. This year it is happening in February. So it usually happens either the first 2 weeks of February or the last 2 weeks of January. Okay, so waiting until you get a letter of acceptance, whether it's med school, dental school, nursing, or whatever have you, is the wrong answer. You could inadvertently cut yourself off at the knees. Okay, because if your board is on February 1st, your packet has to be completed 100% by January 1st, 30 days in advance. Okay, what's going on January 1st? That's the holiday time. So that means you're probably not going to answer my phone calls or anything like that. There's a lot of stuff going on. January 1st, I'm probably going to be asleep. Okay, because we get the day off. So again, you got a backwards plans. What I tell everyone is, if you are interested in this program, you need to be contacting us. Even if you're an undergrad, have a conversation with us. All right. But if you are going into your senior year, you need to be in contact with us and starting this process that summer prior to your senior year starting. Okay. Don't worry about the nuances. Don't make up your own minds and answer your own questions. Call us. This is what we do for a living. You guys are going to be masters of the universe in your field. We are masters of this universe. We put people in the Army for a living. Trust us. contact us and we'll get you through this process. There's never such a thing as too soon to contact a recruiter when it comes to this program.
You had your hand up.
Yeah, I was wondering about, so I'm contracted to get the RDC program on campus.
Mhm.
So I was wondering if the security clearance, like the dog certification that we do there streamlines that process.
It helps with your medical. So we use Domer for your medical processing.
Okay.
So you don't have to go through all that, do a test program, all that. The thing with ROTC is you have to get an ed delay. Understand that. Have you contracted?
I have.
Okay, understand that the ed delay, it's likely, but it's not guaranteed. So you need to be talking with your ROTC advisors to make sure that they know it's on the board, that, hey, I am going to be applying for an ed delay, so that way they can advise you, okay? Again, I have not seen where one has been denied. However, that does not mean that's guaranteed that they're going to give it. Hey, things change year after year, so they don't have to do it. So just make sure you're talking with your advisor about that.
That's your ROTC advisor, not me.
Yes, thank you. Your ROTC advisor.
I'm not in charge of that. I'm in charge of getting you done.
And for those of you who are on Zoom, who are in person, if you know someone who's interested in these programs, as far as medical, dental, any health profession, if they have not talked to your school advisors, they need to do that, okay? Again, we are experts at putting you in the Army and putting you through this process. I am not an expert at what it takes to get into medical, dental, nursing school, or whatever have you. They are. You need to talk to them. They need because they're going to help you go through that process. So make sure that you're beating them up, okay?
So we have two questions, and I don't know if we can answer the first one you have, but maybe we can get the recruiters to find somebody who's done this program. But what are the past students wishing they would have known before enrolling in the program? So maybe we can.
Okay. I was trying to understand. Okay, so what's their advice on doing this? The biggest thing that I hear is, I wish I would have called you sooner. That's the biggest thing, is that they made their they went online. And I challenge you, go online, do your own research, look into this thing, okay? But they only went off of what's online. That stuff is outdated, okay? It is generic. We have the updated information, and our stuff updates sometimes it updates daily, okay? So that's the biggest thing, is most of them say, hey, you know what, it was stressful for them because here their board is next month, and then they just contacted us 3 weeks prior to the board. Okay, and then we're running them through the gamut. Okay, and we're not, and it's not that we're not nice about it. It's just we have to put a lot of pressure on you, otherwise you're not going to get it. Okay, so that's pretty much what they told me is, hey, I wish I would have started the process sooner. I wish I would have contacted you sooner. And
I have a couple of alumni who have done one of the HPSPs that we could probably get in touch with, but I don't have an Army. I do have a Navy and an Air Force. So.
If anyone has questions and wants to talk to someone who has received this scholarship program and see what it's like, because again, I'm enlisted. My job before I did recruiting was I kicked open doors, I shot people in the face. That's what I did for a living. All right, cool. But and your guys' job is to fix that. So if you want to talk to someone who's done this program, please, again, get in contact with us. We can arrange that. We have those people on standby who love to talk about their experience. If you want someone who loves to talk to someone who's received this program, they get to talk about themselves. And everyone loves to talk about themselves. What was the other question?
The other question was, and I can kind of say it this way. So the question is, what are some commitments in the past the students were not aware of? What I love about the Army and the Air Force and the Navy and the recruiters is that there are no smoke and mirrors. They haven't told you anything, that they have not told you that there are any surprise commitments. However, you didn't really talk too much about deployment.
Yes.
Maybe you could share a little bit about the fact that you are in the military and you will deploy.
So yes, so again, I go back to my previous comment of, if you come into this program and you have the mindset of when, not if, you and your family are going to be just fine. I've been in the Army for 25 years. I have deployed on numerous occasions. Sergeant Mathews and Major Wright also deployed on numerous occasions. One thing that we've always done, and one thing I see happy people who are in the Army, okay, keep their family involved. Again, this is not just you. This involves anyone that's close to you. If you are married, if you are not married, and if you are just really close with your family, whatever have you, Bring them down to us, okay? Let them be a part of this program, okay? Deployments, it's gonna happen, all right? This is just the world we live in. Medical professionals, what do your deployments look like? On average, you're looking anywhere between 3 to 9 months, okay? 3 to 9 months. Again, not guaranteed, but that's your average. Okay, a deployment does not necessarily mean that you're gonna go get shot at. You're not necessarily going to Afghanistan, Iraq, or a war-torn country. When you think about medical professionals, think about the Ebola outbreak in Africa. We were first on the ground. When the tsunami hit in Japan all those years ago, we were first on the ground. Venezuela, right? Venezuela. When Venezuela had all their nonsense going on, we were first on the ground. The Army cuts through red tape better than anyone else out there except the WHO. We are the first ones there. Okay. Again, not necessarily out of country. When COVID hit New York, we were the first on the ground. So a deployment does not necessarily mean you're going out of country. A deployment means that you are leaving your home station of wherever that is and going somewhere else for a temporary duty. It also means that your family cannot go with you. That's all deployment is that you're going somewhere without the family. That's it. Okay. The other thing is, it is not a revolving door when it comes to deployments. Okay, so if your number is called, you're not going to come home and then go right back out the door unless it's something extreme. Okay, an example of that would be 9/11. Okay, very extreme. That's when I got hit. I was gone for 3 years, a revolving door for 3 years. Come home for a couple months and I'm right back out the door. That's just the way it worked. Okay, those days are gone. Okay, the Army understands that we can't put that kind of stress on our soldiers, our officers, lower enlisted, all the way to the generals. We can't put that kind of stress on it because it will break us. Okay, so we have what's called an oxygen cycle where, hey, we give you some time off in between your deployments. Okay. Humanitarian missions. And humanitarian mission will be like the Ebola outbreak. So we go out there and we do humanitarian work. That's what medical providers are there for. You're going to go and help those who don't have, their government doesn't have the resources to give what we can. Okay. If you're in a medical profession, your sole purpose normally is, I want to help people. Okay. You're going to get that opportunity. Again, is it guaranteed that you're going to get to go into cool countries and do this kind of stuff? No, it's not. However, can you ask to do that? Absolutely, you can. Okay. If you set your mind to if, not when, you and your family will be okay. The ones that I see where families get torn apart is they're always hoping and praying that they don't have to go anywhere. And when it happens, no one's ready for it. And it all heck breaks loose.
I think that answered the question, hopefully. If it didn't, please put it back in the chat in another way. Anybody else? Shannon, Josette, Zach?
I'm still just a little bit confused on like specialty.
Okay.
So when you finish, say you do get into dental school, do you apply and try and match for residency like right after dental school, or can you specialize like through the Army?
No, so well, the specialty is going to come through the Army. We're going to put you through that program.
Okay.
You apply for your match your 4th year.
Okay.
That's when you start. That's when you do that. No, you don't graduate and then apply. Does that make sense?
Yes.
You already have it lined up. It's just like this. You're going to apply with me in your senior year, not after you graduate.
Yes.
Okay, because then you missed the boat. Make sense?
Yes. Okay.
So you apply for your specialty in dentistry through the military your senior year, when your classmates might be applying for a civilian specialty, if you decide to do that.
Anybody else? Yes.
So I'm looking into USAS and HPSP.
Issues.
Yeah.
Okay. So yes. Thank you. That's one point I forgot. Do not count this. Do not put all your eggs in this basket. Okay. As I said earlier, highly competitive. And I say that for multiple things. Number one, when you're applying at schools, no less than, I would say, 7. When you're applying at schools, don't apply at anything less than 7. What I tell people is, hey, have your dream school. So dream school for medical will be like Harvard Med, dental will be like Columbia. All right, those are your top-notch points. Okay. No, we don't care what the tuition costs. All right, if it's $600,000 or if it's $20,000, we're gonna pay it. Apply those dream schools that you're like, maybe. Apply ones you know that you want to go to, that you're competitive for, and apply ones you need a pulse. Have those safety nets, because there is nothing sadder than somebody who has received a scholarship and does not get a letter of acceptance. Happens every single year, okay? Make sure you are also securing other financial means to pay for your school. Again, if you're counting on us to do it all and you don't get it, and you haven't gone through the process of securing other financial stability while you're going to school, then this is not going to happen for you. U-shoes. All right, U-shoes, what that is, that's the, I forgot what the.
It's the United States Medical Corps Hospital Medical School. So it's basically a medical school for someone who really wants to be a lifer, who wants to stay in the military and be a physician. And he's right. If you only bank on one school, whoops, this is not safe, okay? And the benefit of you being already in the military is that you're going to be expected to have quite a few letters of recommendations to be able to get into that school. One of my Navy SEALs came back and did his postbac work here, and he, the first year, only applied to USHIS because that's what he wanted, right? He's already a lifer, he already wanted to do it, did not get it. And he was a Navy SEAL for 10 years. It's like, okay, so his advice is down, in that you want to find both financial options that work for you, and you want to also make sure that you're fighting. By all means, apply to USHIS. It's a cool opportunity for someone who's really wanting to be a military doc, but it's not the only way to be a military doc.
So the pro and con of U-shoes is this. Number one, the pro is exactly what you just said. The con of that is you do not know what service is a service non-specific program, meaning you will not find out what service you go to until you're getting ready to finish. Okay, then they're going to tell you you're going Navy, you're going Air Force, you're going Army. Okay, now depending on if you want or what specialty you're looking for, that again, you saw we have more than everyone else. So if you go into the Navy, the specialty that you're interested in may not be available to you. You may have to do a general practitioner obligation before you can apply to that. So that's the downside of it. Also, and that's pretty much the only downside to it. Okay, so is that you don't know what you're getting until it's done.
It's also an 8-year contract after that, too, right?
I believe it is.
Yeah.
So
Again, it's someone who is set on wanting to be a military physician. And it makes complete sense in that mindset, but he's right. You don't get to pick the branch that you choose, whereas with HPSPs, you can do that. You can.
And you also get to choose your school with us. So that's the other benefit. But I highly recommend to apply to them because it saved one of our applicants this year. She applied at a few schools. Again, she didn't take our advice. Only applied at a handful of schools. Didn't get into any of them, but she got accepted in USHIS. So she's still able to go and become a doctor. But she just didn't, and she got selected for the program, but she didn't. But we couldn't help her because we don't pay for issues. So that saved her career, her medical school career, for the year at least. You know, but again, and then also I challenge you to talk with the other services. Okay, I'm not scared. Okay, do I look scared? No, I'm not scared. Talk with the other services because again, 275 medical programs, only 75 dental programs. Okay. They have way less than we do, but again, branch yourself out there and give yourself the best odds because at the end of the day, your loyalty should be to those who are helping you get to the next point in your career. Okay, if I can't do it, you know, then maybe the Navy or Air Force can. So make sure you're talking to everybody. But pick us first.
I also realize that just so you know, because he opened the door. Air Force is tomorrow at 1:30.
If there's more people at the Air Force than there is today, I'll be very, very hurt.
I don't think so. I don't think so. But anyway, the Air Force is tomorrow, Navy will be in November. And the other part I would really, really stress that is part that they've said several times today is commitment. This is a commitment. This isn't just free money. This is a commitment that you have to sell yourself to. In other words, you have to say, this is what I want. This is important to me. I will share with you, I have a cousin who her spouse went through the military, did 20 years as an oncologist in the military on the HPSP scholarship, and now he is still a practicing physician in the civilian world. He retired, and now he's getting 2 paychecks. This is a really cool opportunity, but it has to be right for you. And I can't stress that enough. They want it to be right for you too. So because it is a commitment and it is important that you be aware that this is the military, but it's a really great option too. And we've had several students, and I say several, I mean in the 10 to 12 or higher, do this scholarship opportunity depending on the branch. And I would say I usually have 2 or 3 a year. So, and they get them, and they are loving what they've done. Their decision has been a good experience.
Yeah, there's, to me, I'm a practical guy, a logical guy, I've been around the block at least 3 times. I don't see a whole lot of downside to it. The biggest arguments I have for this is that I can't go and it takes away too much of my freedom. You know, what's military life like and all that. That's something you can talk to us offline, but I will tell you, I have my own life. I ride Harleys, I skydive, I snowboard. I just got my Epic Pass, so can't wait for it. It's in the mail, so I'm looking for that. So, I mean, I travel a lot. I mean, it opens up a lot of doors. It is a lifestyle, but this is, if you're thinking that there's some kind of nefarious thing, like what's the hidden thing? This is a job. Okay, this is a job. There are certain requirements that we have to do. There are certain stipulations that we have to do. I have to ask if I want to go on vacation. If I'm going to go on vacation and I want to go to Italy, like I was going to do last year, thanks COVID. I have to ask for permission because I'm going, and that's not because they're trying to control me. It's a safety thing. Everything that we do, all the decisions that we make, all the weird stuff that everyone hears about the military, it's not done out because we're horrible people when we just want to get in your business. There's a safety reason behind it. So again, get it from a horse's mouth. Talk to us. If you don't want to hear my side of it and you want to actually hear it from an actual practice physician, ask me. I will put you in touch with those individuals. So that's all I have.
All right, well, thank you, Pam. Good round of applause. Thank you so much. All right.